Let us now talk to the Gauteng Health MEC, Dr. Bandile Masuku, who joins me now live via Skype. Dr. Masuku, always good to have you with us. Good afternoon to you.
Good afternoon, and good afternoon to your viewers, and thanks for having us on your show.
Thanks so much for coming through. So, in Gauteng, we've seen a dramatic increase in the COVID-19 numbers, and you earlier said that soon the province will pass the 1 million test mark. Do we attribute this to the high number of people testing now, or do we attribute it perhaps to the backlog that was of concern to you previously?
No, I think now it's a matter of the number of tests that we have done. The backlog has been cleared, and now we are working around the usual turnaround time of 24 to 48 hours in terms of the test. And I think we wouldn't be able to get the numbers, discover the number of the people who are positive if we are not doing enough tests. So one of the things that is important is for us to continue to do the test to discover more and more people, even those who are asymptomatic in a main.
So many experts have touched on the fact that as much as South Africa is now fifth in the world with the high numbers of confirmed cases, but we have a low mortality rate. Let's just bring it here to Gauteng, where we have over 128 confirmed cases as it is now and about 956 deaths. The mortality rate may be low, but one life lost is too many, MEC. What do we attribute these low mortality number to?
I think we have to give it out to our clinicians in terms of the quick interventions. And I think we have realized so far that the earlier you intervene with oxygen and a number of interventions, it makes it easier for the patient not to get to be a complicated case. And I think we should give credit to our clinicians by that who have really managed all these patients in our facilities. And I think it's all about their work and what they put in that regard.
Now that we're approaching the peak, things are expected to sort of spiral out of control very soon. What's going to happen going forward? Is the province going to employ a different approach, a different prevention strategy, perhaps to deal with the situation, or are you staying with what you've been going with all along?
Yeah, I think our idea of the peak is not about us being out of control. I think we just think about the highest numbers of infections that we will be getting. And I think we are also looking at the situation where our healthcare system will be able to take care of those who will be requiring medical attention at that time. And I think the peak would be something that we are going to appreciate in terms of the numbers, but it shouldn't be about the total loss of control or total loss of management of patients in facilities. So we are approaching it in that way, and still tracking and tracing is our biggest strategy in terms of us being able to identify, isolate those who require isolation, quarantine those who require quarantining, and that's how we'll still continue to control the rate of infection in the province.
So I said we're sitting at 956 deaths. So I see the latest from your office now that the province has 133,617 confirmed cases, 986 deaths as it is today. And there are predictions that the number of positive cases may triple to over 300,000 by the end of this month. Do you agree with those numbers? Do you agree with that statement?
The modeling was pretty much quite close to the prediction, but well, in terms when it comes to the mid-July, I think when we made our first initial modeling, we did talk about how July would be, and we'd be able to reach 140. And it clearly shows that by the end of July, we would eventually reach 200,000. And it's something that we are looking quite closely, but also preparing all the necessary interventions to make sure that we don't get to that point where people say it's spiraling out of control. But the predictions were pretty much close to what we are actually seeing now.
But seeing that we've got the predictions now, MEC, is it not possible to sort of stop the numbers from going that high? If we know that by the end of July we may be sitting at close to 200,000, can something be done to ensure that the numbers do not go that high?
There's a lot. There's a lot that can still be done. I think much of it is just about how the public and the community actually behave and how they embrace the regulations. And we are still going to see the impact of the new regulations in the next coming weeks, how they are going to impact on it. But we are also going to see how the issue of the alcohol is going to have impact on our trauma units and how the beds would much be easier accessible. But thirdly is that how the ward-based approach that we have launched, which is going ahead in terms of spreading the message of prevention, spreading the message about regulations, all that is something that can still be done, and it's something that we should be doing. And as government, we are, in actual fact, implementing that particular program. So there is a lot that can still be done, and it's all about how government and the society and the community can be able to play that role to reduce the rate. But again, there is a majority of people that might be infected and wouldn't know because they are asymptomatic, and those are the ones that are much problematic. So we normally create a space or accommodate that statistics in terms of that, because those are people who will silently spread the infection.
So you talk about the fact that in some instances it all depends on individuals' behavior. And the question now is, what is your department doing? Do you have any activations, programs perhaps to talk to the communities, to reaffirm the messages that have been put through in dealing with this COVID-19?
Yeah, tomorrow we will be descending in one of the wards, the areas that have got the highest active cases in Johannesburg. It's going to be an intergovernmental activation that involves COCTA, that involves police, that involves the South African National Defence Force. But it's all about educating and raising awareness about regulations and also awareness about the prevention of the of COVID-19. So the activations are continuing. And you know that the president deployed some of the ministers in different districts, and part of the activation that will be tomorrow in Region G, which is around Orange Farm and Lenasia South. That's where we would be tomorrow to activate and raise awareness as it is.
But what have your observations been since the ban again on the sale of alcohol from last week Sunday? Are we starting to see some change in terms of the trauma wards and in hospitals?
Yeah, I think that's why I said we'll be able to get a better assessment at least in the next week or so, because some of the effect and the positive impact that would come from the regulations would feel them 2 weeks after them being implemented. So it's something that we are looking at, and we are quite keen to see. One thing that we are convinced about is the effect that was there under lockdown level 5, and how our trauma units were pretty much empty and they were not actually overstrained as they were under level 3. So that is what experience and the experiment or the experience that we have had with lockdown level 5 and lockdown level 3 in terms of our trauma. So we'll see the impact going forward, but we are quite confident that with the banning of the sales of alcohol and transporting, it will bring about a significant change.
All right, so just very quickly, we need to go back to the State Capture Commission now. But Minister Zweli Mkhize today touched on the shortage of staff complement. How are you dealing with it? Because when people are hired, there are human resources processes that are involved. How fast, or how are you going to fast track the hiring and perhaps the retaining of the volunteers that you already have on the system now?
We are looking at different ways. Other ways that we've looked at is the issue of working through agencies. And the other one is to also look at the database that we have had, which will actually limit the space and the time of people applying. And the third one is also doing direct contracting of the individuals or of the professionals that we are dealing with. So there are different ways, and we are not using only one method, but the only way that we are, only objective that we have is to make sure that we do have staff as required and on time. And it's a continuous process. We are going to see close to 1,582 that will be employed by the end of this this month, which is July.
All right, I wanted to touch on the oxygen here at the Nasrec Fields Hospital, but time constraints, MEC. We thank you so much for your time.